can we categorize a group of people that would be at risk for osteoporosis?
There are known risks for osteoporosis. One is just the female gender, postmenopausal, that puts a person right there in one of the highest risks. The age after menopause, and for men later after their 60s. And diet is a factor. We always recommend people to have dairy products because these are rich in vitamin D and calcium, and these are essential for bone remodeling. Smokers and coffee drinkers are at a higher risk. And lack of exercise, family history of osteoporosis. If a person knows that their siblings or their parents have osteoporosis, they are at a higher risk of osteoporosis.
Okay.
And also the use of medications over time that can reduce the bone mineralization can affect osteoporosis risks.
Okay.
So these are really the risk factors for developing osteoporosis.
So some of the medicines that come to mind for me that might increase the risk of osteoporosis would be like chronic steroids, somebody who has bad asthma is always on prednisone. And I think if you're overtreated on your thyroid condition, in other words, people love to get their thyroid medicine, they think it will help them lose weight, but if you're overtreated in your thyroid medicine, it could put you at risk of osteoporosis. So that for any of my patients that are watching, this is one of the reasons why we don't want to overtreat you with your thyroid medicine. You talked about calcium and diet and dairy being very important for strong bones. Specifically, I'm always telling patients 1,000 milligrams a day is required for premenopausal patients, and 12 to 1,500 milligrams a day of calcium is recommended for postmenopausal or women over the age of 50, and for men as well. And when you're trying to think through those numbers, I always think about a yogurt or a serving of milk as being about 300, 325 milligrams. So in order for a 55-year-old woman to get the required dairy or calcium through her diet alone, that's 5 servings of dairy, and most people really can't do that. So that's where the calcium supplements really come in handy.